Good evening, one and all. We welcome you all to the international webinar series on holistic health, well-being and sustainable development 2022. You all know that we are celebrating World Social Work Month, commemorating that, and Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, and as part of international conference on social work and sciences towards One Health and sustainable development, organized by in collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Arts, Sciences and Wellbeing and other collaborators. Today we have eminent speakers from Association for Transgender Health in India and other collaborating organizations. So before we start the proceedings of the webinar, let's invoke the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
The blessings of Almighty. We shall continue the proceedings. Welcome to you all once again, and we welcome the speakers for the day, Dr. Sanjay Sharma, CEO, Managing Director, ATHI, Board Member, WPATH, and WPATH GEI SOC 7 Certified Member, is also retired Air Commander. And we have another speaker, eminent speaker, Dr. Bela Sharma, MD, Additional Director, Internal Medicine, FMRI, Medical Director, IPATH, that is Indian Professional Association for Transgender Health, Founding Director, ATHI, Association for Transgender Health in India. So we welcome you, sir and ma'am, for the wonderful day, and we are looking forward for the sessions. And I invite Dr. Sanjay Sharma ji to kindly take over for the session on demystifying gender, providing gender affirmative care. Over to you, sir. Thank you for joining us. We welcome you again.
Thank you, Professor Ravindra. It's such a privilege to be here and to be speaking to such a varied audience, and on a topic which is so important because once we understand human beings, then we can understand how to make them comfortable. And once we understand that there is more than one form that the Lord Almighty put on the earth to enjoy whatever creation that He has put for us, then we give them space. Just as it would be so boring if we had just two types of flowers in our garden, or we had just two types of animals in the world. No, God has not made the world binary, and diversity is the norm. Diversity is what defines life. Diversity is what makes us so vibrant. And diversity is something which we in the Indian subcontinent embraced. While the rest of the world was using science and technology to build weapons, we were using science and technology and knowledge to live together for agriculture, for making cities which were far advanced than what the Western world had ever imagined. And it is so evident in the Harappan civilization, in the old archaeological excavations that happened, and in the fact that we celebrated diversity and put it on our temple walls. Yes, we, the owners of diversity, today look with confusion when we are told about diverse human forms. When we are told that, look, the foreign knowledge that has been imposed on us, the erasure of our culture to with ideas which were binary, it forces us to rethink. And yes, let us reclaim our heritage and learn about the diverse human forms. So I was very pleased when Professor Ravindra asked me to speak to you. And today is such a special day because today is a day of transvisibility. 31st March is celebrated as a day when folks who are not binary are celebrated. So my task is to demystify gender and also talk about gender affirmative care. And over the next 1 hour, I'm going to slowly take you through this journey. But first, let me use technology and share my screen, because I did, prepare a small presentation which I want to share with you to explain my or put my points more forcibly in front of you. So let me get my presentation. To 10-15 minutes. The pause is so that you can ask me questions. And while I start with what is the what, why, and how of gender incongruence, I would request you to ask me questions. So, gender, the perception of who I am, is something which one perceives very early in life. As early as 2 years of age, children know what their identity is, what they perceive themselves to be. Well, before I confuse you further, let me tell you that when a child is born, we look at the child and we see what the external appearance is. And we tell the parents, look, this is a boy or a girl. Or if you're not decided, we take a breather and say, okay, we are not able to make out. But then we assign a sex, male, female, or ambiguous. And we go forwards. This is sex assigned at birth. This is based on what the people around, the adults around have seen. It definitely does not align with what the person perceives themselves to be. And what a person perceives himself to be is what is known as gender. What I perceive inside, what I think about myself. And this thought starts very early in life. As early as 2 years of age, children know what they perceive, but they look at society, at people around, and try to identify as to who do they identify with. And this identification is based on what is known as cueing. By cueing, which is done by parents, by well-meaning adults around, who tell this child what is the role that this child is supposed to follow in society. And this is known as gender cueing. I do this gender cueing through the toys that I put in front of the child. I do this gender cueing by the clothes that I put the child to wear. Most of us are okay with what is told to us. About 90% would be okay with the label that is given to us. And by the age of about 2 years, we sort of say that, yes, we agree with this. And then we continue in that assigned role to perform in society. This is, if this is how I'm comfortable, if this matches the sex that I've been assigned at birth, then I would, be congruent and go on to have gender consistency. However, a large number of children, as large as 14% of boys and 11% of girls, may not agree completely with the role that is put in front of them by the adults around, by the cueing that is given. So we have children who are still experimenting with the identity that they have. They are still not decided as to who would they match with. And this is known as gender fluidity. By and large, by the time puberty kicks in, this thing gets frozen, and one affirms to the gender and starts expressing themselves in the form that they identify with. And how I dress, how I walk, talk, behave, this is my gender expression. And this would tell the other person what I perceive myself to be inside. Like I said, most of us are okay with what is presented. But then as we grow past through puberty and the hormones start coming in, a new feeling comes in. This feeling is of attractions, which are very different from those that we have for our loved ones or the family members. We get attracted to other people like us, to the peer groups that we move with. And it is more of attraction, which is the attraction of the heart, the attraction of the desire to have sexual pleasure with somebody. And this is known as sexual orientation. My desire to be with another human being, maybe with the same type, and which we would say is a homosexual orientation, or now it is called as being gay or being lesbian. If I am a female and I'm attracted to another female, then this is a sexual attraction which would come in the group of what we know as lesbian. But by and large, about 80% of us have an attraction for the opposite, and this is known as the heterosexual orientation. Gender is all about perception. And when we talk about orientation, it is about attractions. And these attractions, they come on during the growing up phase. And if they match what is expected, then we would call this to be congruence. But if this does not match, if what I am feeling inside does not match what the society is expecting from me or what the physical structures I have, then I would fall into what is known as gender incongruence. This is broadly covered under the umbrella term of transgender. When we are different and we are faced in a situation where the majority is not believing our narrative, then there is a fear of non-acceptance. And this fear of non-acceptance is what pushes us into hiding our true selves. And this hiding of our true selves is commonly called as closeting. Now, this closeting may occur very early, like when I am in preschool age, and my schoolmates or my teachers are telling me to behave like a boy or behave like a girl, and I have a mismatch of perception, then I will hide this and I will enter a closet. It may happen that my family is giving me toys which do not match the perception that I have. My family or my neighborhood is expecting me to behave in a certain fashion which does not match what I feel inside. Again, I will hide this and enter the closet. Or it may happen later when I am growing up with other children and I'm passing through the adolescent phase. And adolescent phase, as you very well know, is such a difficult time for everybody. And in this time, when my sexual orientation does not match that of the majority, then again, I am going to go into a closet. It may happen even later when I have successfully navigated the adolescent age group also. But when I, as an adult, start interacting and I start, realizing that what I perceive to be inside does not match with what society expects me to be. When I have done my experimentations and I realize that the results are not the same as that of the majority, I may get into a mismatch as an adult. And again, in order to conform to the society, I may hide this and go into a closet. Now, this closet is a very dangerous space. A closet is a place where I stop interacting with people who can help me the most. It's a place which increases internal conflict. And if this internal conflict is coupled with a feeling of non-acceptance or non-resolution of my issues, then I will get into an external conflict. And this external conflict, mind you, starts at the time when I am going through puberty at an adolescent phase. And this combination of internal and external conflict, non-acceptance, and non-resolution leads to a very uncomfortable feeling. And this uncomfortable feeling is what is known as dysphoria. Dysphoria is what forces me to get into high-risk behavior because I have now excluded people who can guide me, parents, teachers, society at large, who can help me decide the consequences of my actions. Would I close my doors to that, and that would lead me to high-risk behavior. Non-resolution would lead to self-harm, substance abuse, mental health issues, and further on, go on to lifestyle disorders, the sexually transmitted illnesses. All this combination producing a decreased life expectancy. And statistics say that people who are diverse, people who belong to the LGBTQAI plus community, who do not conform to what the society expects them to do, have decreased life expectancy. A lot of them do not reach the fourth or fifth decade of life. A lot of them fall prey to violence. A lot of them fall prey to lifestyle disorders, mental health issues, substance abuse. So what can we as society do? Because I think for any dialogue that happens on this platform, it is very important that we look to what we as society can do. What can I do? Where can I make life comfortable? So if there is one point that I want to avoid, then I want that all human forms be comfortable. And if there's any factor which makes them uncomfortable, then that becomes my action point. Because if I prevent this dysphoria, then I would be able to allow that diverse individual to grow as a productive citizen of the society, to be happy, to be comfortable in the body that they are in, to contribute to more happiness around. And hence, the intervention points that I look at are to reduce the internal conflict, to reduce the external conflict. And the best way to do that is through these dialogues which happen when people like us who sit down to increase our knowledge through these webinars understand how important it is for us to listen, how important it is for us to prevent children from going into the closet, and how important it is for these interventions to happen early so that we do not end up with lifestyle disorders and decreased life expectancy. The mismatch may, like I said, when it happens very early, the intervention points also need to be very early. The school teachers, the primary care providers need to know, need to give an environment which is gender affirming. Not go on to the old way of saying that boys do this and girls do that, but give an environment which prevents increase in dysphoria. Accept the identity, and for that, use the language that is friendly. Not use words which are hurtful. Not use words which would be demeaning, which would be dehumanizing. And for this, the primary care providers need to know. We need to understand this normal process of growing up. This is not something which only doctors should know. This is something which teachers should know, that children know what they are. If they are expressing themselves, please believe their narrative. Understand gender identity. Understand that what is being expressed is to be accepted. Understand the difference between gender and orientation. Understand that we need to prevent closeting. And that is the most important uh, uh, thing that we as individuals in society, be it family members or teachers or society at large, do. It is only if we understand this that we will be able to uh, allow our children to be happy and to grow up in a safe environment. Before I go on to safe spaces, like I said, I'm going to take a pause. And I'm going to invite you to ask me questions if you have any so far. Uh, Dr.
Yes, sir.
Ravindra, if there are any clarifications, anything that we have, any audience wants to know, I am here. I will take a pause for 30 seconds and then I'll move on to safe spaces, because that is the next part of my talk.
Participants, if you have any queries or clarification or comments, you can quickly raise your hand so that we can unmute you.
It's very important that we understand that human beings are not confined to the binary. There is medical evidence which tells us that there are shades of human forms. We may have two extremes, but then there is a spectrum in between. Just as you have so many lovely flowers in the garden, such as you have so many different forms in the world, we also have diverse individuals who have as much right to be in the society as people who conform. And once we understand this gender incongruence, which is loosely termed as transgender, as under the umbrella of transgender people, then we will be able to provide for them and take them along, give them space, allow everybody to be happy, which is the most important thing to do. I will go on to the next part of my talk, and herein becomes the importance of happiness. Happiness by allowing people to feel safe, because only when I am safe can I be happy. And when I say that give a safe space, what exactly am I saying? Actually, what I am saying is that in this space, you are secure. There is no threat to you. And threat can be both mental as well as physical. It may be through the language that is used. Am I going to be called hurtful words just because I do not conform to what you, the majority, perceive the world to be? Are you going to act to remove people who are diverse because you don't understand them, so remove them from the space? Are you going to allow me to be who I am in the space? Then I'm secure. If you're going to accept me as I am, with no need for me to color the truth, then I'm in a safe space. This freedom to be my true self, whether I am in a school, whether I am in a workplace, or I am in society at large, I am in public spaces. Can I express myself as I want to be? And most importantly, am I being given equity? Do I have the same privileges? Or should I say that there are no privileges for anybody? Each and every form that is in this space has the same kind of treatment that is given. If this safe space is secure, makes me feel accepted, allows me to be my true self, and gives me that feeling of equity, then yes, this is a safe space. But is this enough? Well, no. It also needs to be a space which will support me. That means if there is some wrongdoing that is done to me, then there will be support that will come up, wherein people who are not like me will stand for me, will protect my rights, will ensure that the laws that have been made, and there are so many laws that are there, but when it comes to diverse people, are we allowing those laws to be effective? Am I going to live as long as you? Am I going to get hurt? It should allow me to affirm myself. It should be comforting for me. And in this space, I should be able to do whatever I wish to do. It should empower me. And empowerment comes through very small things. Empowerment comes when I allow you to voice your feelings. I give you more leeway to express yourself. I give you protection with the laws. I give you a little more care than the majority who are there. And all this is part of empowerment. And if I am being empowered, then this is going to really help me. And yes, it is only when I have all these elements that I will be in a safe environment. So here's my question to the audience. Are we willing to provide a safe space throughout the year and not wait for 31st of March to do that, to talk about it? Are we really going to understand the diverse human forms who are there and give them a safe space which is supportive, protective, affirming, comforting, and empowering? Because if I do that, then again, I will have happiness. And having said this, I think I should take my second break and ask if there are any comments or any questions for me, which I can probably take on.
Yeah, thank you, sir. Participants, if you have any queries, comments, clarifications, you can raise your hand, or you can put also in chat box while session is going on, so that whenever a break is taken, we can ask at that time. Feel free to interact, because this is very sensitive topic and very important topic. It is very much important to understand what actually sex is, what actually gender is.
So while you are thinking your questions, let me put it in a very simple way. Sex assigned at birth is done by others. Others who look at you, look at your anatomy, maybe your organs, maybe do a further test to determine which part of the binary do you fit in. And sex assigned at birth may be male, female. And if the providers, the primary care providers, or people who see you at that time are not able to decide whether you fit towards the male sex or the female sex, then they may say that sex is ambiguous. And this category is also put under the common usage of intersex, and which we now understand to be differences in sexual development. Yes, differences in sexual development, not disorders. Because just as my nose does not match yours, my ears may not be the same size as yours, the color of my skin may not match the color of your skin. These are all differences which are of development. And when we are talking about differences of sexual development, we are talking about the intersex group. Intersex group is one which is most misunderstood. And that is why I thought that I would take some time to talk about the intersex group. Because most of us, when we look at diverse people, assume that there must be something wrong with them. There must be something missing or more, or abnormal. I want you to go away from this webinar with this understanding that there is no abnormality when it comes to nature. Unless there is a condition which threatens longevity. Unless there is a condition which requires intervention by medical people. So intersex people may just have differences in sexual development. Gender, on the other hand, is something which is more about perception. It is more about what I form in my mind, what is between my ears, not what is between my legs. Gender is how I perceive myself to be, who I identify, which human form do I identify with. That is what is my gender identity. This may not match the sex that is assigned to me by others. So the difference is gender is self-affirmed. There is no test to determine gender. Gender requires no validation from anybody. Gender is something which I affirm. Sex is what is assigned, and there may be a mismatch, and that mismatch may be 99% or it may be 1%. This mismatch is what is known as gender incongruence. And gender incongruence is a term which is very recent. It has been put out by WHO in 2018. And it is now the term that we use. The common usage that we do is of using the word transgender, because society at large is still grappling with this concept that gender may not be binary, and it is not necessary that I trans from one end to another. There's nothing like trapped in a wrong body. This is the wrong concept. Each one of us has a perception which is unique. My gender is as unique as my thumbprint. And it is a mixture, it is a web of maleness and femaleness and something in between. Words, we may not have the language to explain this, but then this is what I perceive myself to be. And this is different from what I am assigned. Yes, a large majority of us fit into what silo the society decides for us. And we fit in without discomfort. But if we have discomfort, if this is producing dysphoria, which is a medical term for discomfort, then this requires to be acted on by society at large. Orientation is something to do with attractions which are for other human beings, for procreation, for pleasure, for sexual pleasure. And if it is for the same, or it may be for different, or it may be for diverse. So you have people who are gay or lesbian, or they may be in the majority where we say that they are cis hetero, or they may have attractions for people who are gender incongruent, and you may be scoliosexual, or you may have no attraction as far as the desire to experience sex goes, and you may be asexual, or you may be pansexual, or you may be bisexual. So all these terms where we have sexual at the end is talking about orientation. Wherever we have gender at the end, we are talking about perceptions. So you may be cisgender, wherein your perception matches your sex assigned, or you may be a transgender person, where it does not match. Or you may not conform to what is the majority is saying. So you may be a gender non-conforming person. Or you may at times align, at times not align, and then you may be bigender. Or you may be agender, wherein you do not identify at a cerebral level with any human form. And you do not align with the concept of maleness or femaleness. So you could be agender. However, this is more of a theoretical kind of a term, because none of us can say that we do not have this mixture of the different elements in all of us. So I hope there is clarity about gender and sex assigned at birth and sexual orientation. And the takeaway that I want you to take is that gender does not equal sex assigned at birth and does not equal the gender expression. Because today I may want to exhibit something to you which may not be exactly what I feel inside. But what is most important is that we keep an open mind and we give a safe space to each and every human form. If we don't have any questions or any more questions so far, then let me move on to the next part. And I now need to talk about gender affirmative health care. When we talk about health, we are actually talking about well-being. And when we talk about well-being, we are talking about not only physical well-being, but mental well-being, social well-being, spiritual well-being. And when we talk about gender affirmative healthcare, or today's topic is more concerned about transgender healthcare, then we are talking about care that needs to be given through a system that is multidisciplinary, involves multi-specialities. And herein, this care is not for patients. These people who are to be given care are not coming to you for treatments. They are individuals who are seeking care to reduce the feeling of discomfort that they have experienced because of the gender incongruence that they experience, and the incongruence that is there in society towards them. That non-acceptance which has magnified this discomfort. They are individuals who are seeking to align their inner self with their the roles that the society is putting for them, or even the bodies that they want to become more comfortable with. And hence, gender affirmative healthcare is not about cure. It is all 100% about care. Why we have already covered, but who leads this care? Who is the person who will decide what care is to be given? What degree of care is to be given? Well, when we talk about gender affirmative care, then what we are saying is that the individual decides the care that needs to be given. We will be talking about when to start, what to do, who can advise, and for how long. But first, let me talk about the why. Why does one need gender affirmative care? Well, the simplistic thing is so that one can align with one's true self. I can be who I am. It is, I need this care for myself, not because of any other thing. Yes, I need it so that my discomfort goes down. I need it so that I do not closet myself. I do not need to closet myself. I can interact with other people who will not judge me. It is also there to prevent me from going into a negative situation as far as my mental health goes. So yes, one would say that gender affirmative care is required so that there is less self-harm, there is less depression. But then those statistics have happened because we did not provide that safe space. We are the ones who did not listen to the narrative. This care is required because once I understand gender affirmative care and I understand that it is all about well-being, and if I can pass this well-being to that child in school, then this child will not lose out the formative years, lose out the fun of growing, and not have loss of self-esteem. So who leads? The individual. Yes, the individual. It is the individual who decides when it is to be given, and from the providers who are privileged to be able to give this care, it should happen at the earliest. And how early is early? Well, for the doctors who are attending this webinar and the medical students, we intervene at Tanner stage 2. I know it's a big word, but what it essentially means is that I intervene. If there is discomfort before the body starts changing, because the child may have derived happiness by closeting and being themselves in their pretend play, not exhibiting it to the adults around. But the moment the body starts changing, I perceive myself to be feminine and my body is turning masculine. Then I need intervention. And this starts as early as 9 years of age. Yes, 9 years. 9 years is about 4th class. If you close your eyes and you just think back, that when did your body start changing? When did you notice the girls in your class becoming different? When did you notice the boys in your class becoming different, having hair coming up? When the boys maybe later, but the girls definitely earlier. And hence, the intervention, if it is started early, in individuals who ask for it, or in individuals who are uncomfortable. And who can advise? Well, the primary care provider. So when I say primary care provider, I mean the family. I mean the family physician. I mean the primary school teachers or the teachers. They are, after all, the first people who get into action to provide care. And if they see the ward under their charge becoming uncomfortable, then they can very well advise gender affirmative care. But for that, they need to be knowledgeable. For that, they need to be like you, to take out time and sit down and listen to a webinar like this. And you would have also understood by now that this care, which is largely given in hospital settings, in settings which are require medical interventions or surgical interventions, we require a teamwork to happen with the individual as the leader and the team members being the primary care providers, the secondary care providers, and maybe the tertiary care providers. And in this team, we need mental health professionals, we need pediatricians, we need specialists, we need reconstructive surgeons. We also need nursing staff, social workers, parent support groups, legal and ethic team members. Dr. Bela will be speaking more about the parent support groups later. So affirmative care is a teamwork. It is multidisciplinary. It requires mental well-being. So mental health needs to be covered. It requires gender affirmative hormonal interventions. It requires surgical interventions. And it also requires aftercare, because this diverse individual is also going to grow old. And we need to provide care, which is an intersection of what can be done at home, outside the clinics, what can be done at primary health centers, what can be done in smaller hospitals, and what require hospitals with cutting edge technology, which have facilities for fertility preservation, and or maybe doing reconstructive surgery. So it is a intersection of all these components which makes affirmative care. And this affirmative care is worked on a participative, informed consent model. When we say participative, that means that we are participating in the care with the individual, because the individual is the one who knows how much of alignment that they want, how much of care do they need. So we need to take a cue from what the individual is demanding. We need to sit down with this individual and work out what science can provide, whether it can provide what the individual is asking or not, and make sure that this individual has understood that and has the coping skills to deal with it. So hence, it is called a participative, informed consent model. Care needs to be accessible irrespective of what strata I belong to. It needs to be affordable, but most importantly, the care that I am going to provide as a care provider needs to be based on evidence. It should not be some experimental stuff that I'm going to expose the individual to. Because the individual who's coming to demand gender affirmative care from the mental health people, from the endocrinologist, from the reconstructive surgeon, are young people. They are uncomfortable in what inside, and hence we cannot or we need to be very sure and very clear that what we are doing is not experimental, it is evidence based, it is ethical, and it is standardized. Because see, gender, that means what I perceive myself to be, is different for different people. It is different in different regions of the world. What I perceive myself, or the maleness that I perceive to be in myself belonging to the Indian subcontinent, is very different from the maleness that is there in my Western counterparts. Because their way of living is different. My way of living is different. If I go to the northeastern part of the country, I have a maternal kind of a dominance where the ladies take the lead. And this may not match with what is happening in the southern part of my country, or in the western or in the eastern part of the country. So we require care which is Indian, which is standardized to ensure that anybody who delivers care does it based on evidence and ethics. There are certain issues which are more prevalent in diverse people. And the reason why they are more prevalent is because the diverse people are marginalized. The diverse people face what is known as minority stress. The diverse people face intersectionality. That means there are more than one factors which may magnify the minority status that they are experiencing. And hence it's very common to see mental health issues like depression, anxiety, suicidality. Violence, however, is something which happens because the majority don't understand. And since there is a threat, the diverse populations sometimes do not have these social skills to deal with it. And this itself becomes a disability. Now, these all issues need to be factored in when we are giving care. Care which helps an individual align with their true self. And that is what is commonly known as a transition. And this transition happens on 3 levels. The first transition is to understand oneself and understand what would remove the dysphoria that they have. The second is the physiological transition, where one decides that whether they would want to change certain parts of the body to align with their true self. So I may undergo surgeries, I may undergo hormonal interventions to align with myself, and that is more of a physiological transition that happens. And the most important is the social transition, wherein I am able to perform without fear with the majority in a social setting, where I am able to enjoy equity and be have the same privileges as anybody else. So these are the aspects of care that one goes through. And yes, I also want to be a parent, and that is very much a human feeling. So when we are giving gender affirmative care, we do talk about fertility preservation, because science has now the ability to allow any human form to look after another human form and also parent another human form. So what are the interventions that constitute gender affirmative care? So first, broadly, and these are actually broad classifications more for the scientific mind to understand what all is there. It is not necessary that they go in this order, because I may start medical interventions very early with puberty blockers, or I may wait for the body to mature. And the age of maturity is anything when I have achieved my full potential as far as my growth is concerned, and that is about the age of 18, wherein I can now be given cross hormones to allow my body to change into a physiological transition, so that I align with what I perceive myself to be. Puberty blockers are sort of drugs which are given so that these secondary sexual characters, now secondary sexual characters, to put it to the audience who are from the social background, are changes in the body which define you as being feminine or masculine. So breast development or getting facial hair, these are secondary sexual characters. And if we have a child who is becoming uncomfortable, then we can put a pause button on puberty by giving puberty blocker drugs. The earliest we can do it is at standard 2. If there is increasing discomfort that the child is perceiving, it also gives time to the child and the family to deal with the issues that the child has. This does not mean that the child is going to change their mind, but what it means is that the child would be able to develop better coping skills and revise the decisions that they are taking as to when they want to transition and as to how much. it is also a period which allows for adjustment between the caregiver, the individual who is asking for care, and the guardians who are around this individual, the society that is around this individual. And for your information, puberty blockers are like pause buttons, they are reversible. So if the child feels that they do not wish to go further, then they can we can again restart the puberty for take it on. And it also is a time when we prepare for further interventions. That means I have, I'll take you back to the classroom where your peer groups were changing, the girls were changing, the boys were changing, and maybe you were changing faster than others, or you were changing slower than others. Now you want certain, you have decided that you want certain changes to happen. And if we are going to prepare for that, then this preparation period could be achieved by buying time by using puberty blocking drugs. Cross hormones may be masculinizing hormones or feminizing hormones. And just as the word goes, they are to produce more masculinizing features in a body that is feminine, or produce more feminizing features in a body that is masculine. And we understand, the scientific evidence tells us that cross hormones, if they are given for at least a period of 2 years, then the body will naturally acquire the secondary sexual characters that the individual desires. It will reduce the need for surgical intervention. It also, while we are giving cross hormones, we also get the team together and we set realistic goals. Because we may have somebody who feels just because he's got this information on WhatsApp or on internet that if I increase the dose of my hormones, then probably my changes are going to go faster, or I'm going to get more or less of certain sexual characters. So we, while giving cross hormones, work as a team and set realistic goals, and we prepare the individual for the next intervention that the individual may be desiring. There are, however, interventions which may help you pass. And what is passing? Passing is that I want to be known as the gender that I affirm to. And for this, I don't want my secondary sexual characters to be visible or less visible. So I do procedures like tucking and binding. Binding is when the people who wish to be masculine use garments that conceal the breast growth. So this is done by a process called as binding. Tucking is, on the other hand, done by masculine people who wish to be seen as more feminine, and they may hide their external genitalia by a process known as tucking, where they use masking tape to hide the bulge of the testis and the penis. Or they may use hair removal in case of the more people desiring to be more feminine or passing as more feminine. They would require, they would want the facial hair to be removed, the hair on the body to be removed. All right. We may also desire hair to be implanted Because if I am feminine or I desire to be more feminine, then I am looking for a lower hairline. And if you have a hairline like mine, which is more of a male type of a hairline, then I may not pass. So I would use non-medical interventions of hair transplant to cover this up, to get a new hairline. Makeup, mannerisms, and dressing. These are all non-medical interventions which help one pass, help a person be their true self without any other interventions happening. Voice modulation is another way where which becomes both important and maybe not so important too. Important for people who get misgendered because of a heavy voice or because of a squeaky voice. So if we teach them how to modulate their voice to match the gender that they affirm, that means a masculine person, I teach them how to use their breath control, how to use their vocal cords so that their voice sounds more feminine. Then while they're answering the phone or they are interacting with other people, they can pass. And similarly, I teach the feminine individual who wants to appear more masculine how to speak more from the chest or more from the stomach and produce more timbre in their voice and pass as males. Why do we need to know about these non-medical interventions? Well, first and foremost, it reduces dysphoria. It allows a young person to transition during the period when their bodies are changing, but the body is still not ready for surgical interventions. Because surgical interventions can be only done once the body is mature. I will correct my statement by saying that surgical interventions, it is desirable to do them once the body matures. Yes, I am hinting that if the individual and a case-to-case basis, and if the gender-affirming team feels that this maturity of the body has occurred at a lower age, then these surgical interventions can also be done at a lesser age, the age which may not match the legal age of majority. Why is voice therapy important? Well, voice is used for communication and also for expression. Today, when I speak to you, you hear my voice. You don't see me completely, but those of you who, for some reason, are not able to see me, and I'm not able to see most of you, would identify me as a male by my voice. So it's a way, it is used for gender expression. But then voice is also unique. And most importantly, and we tell this to all individuals who come to us for care, that voice is very diverse. So we have singers who are feminine but have very masculine voices. Usha Uttab for one. And we have masculine singers who have very feminine voices. Michael Jackson tried to produce a high-pitched voice. So this is all part of voice therapy, why it is done, why it is important. Coming to gender affirmation surgeries or surgical interventions, then these are broadly done for people where their discomfort is persistent. And this persistent discomfort needs to be documented by the gender affirmative team before we do interventions which are surgical in nature, because surgical interventions are difficult to reverse. Yes, I have chosen my words very carefully, because surgical interventions, though we say are permanent, they are not irreversible. They can be reversed. However, once we reverse a surgical intervention, then the results may not take you back to where you started, may not be give you the same kind of results as you started with. So in that sense, when we put a knife to the body, we want that things should be documented well. The individual who's ready to undergo a gender affirmation surgery should have the capacity to make a fully informed decision and should be able to give consent. And herein comes the age of maturity, which is taken to be 18. But like I said earlier, if the body is mature and the documentation is done, that the individual is able to understand the pros and cons of the surgery, is able to make an informed decision, then this age may be done, or the surgical intervention may be done earlier. Another important aspect for any surgical intervention is that the individual needs to be fit for anesthesia. And hence, they need to be, because when we give anesthesia, we give drugs which alter consciousness, which interfere with the way the mind works. And hence, the major mental health concerns should be controlled before we move on for any gender affirmative procedure, whether they are feminizing surgeries or they are masculinizing surgeries. So feminizing surgeries would be top surgeries, where we look at augmentation of the breast, or mammoplasties, where we put in implants to increase the size of the breast, or it may be a bottom surgery, where we remove the genitalia, like we do a penectomy, or we remove the testes, and we create surgically create a new vagina, and we reduce the glands to produce a clitoris. They are non-genital, non-breast surgical interventions. That means they are interventions which do not involve the top or bottom, but they are surgical interventions which allow you to pass as or appear more feminine. So you have facial feminization surgery. You may undergo liposuction to reduce, to realign the fat deposits in the body. You may reduce the Adam's apple. You may do a voice correction surgery. You may add fat or implants to the hip area. Gluteal augmentation can be done. You can do aesthetic processes, or you can do hair reconstructive processes. So these are, by and large, the gender affirmative feminization surgeries that are done. Coming to masculinizing surgeries, we again have top surgeries, where we remove the breasts to create a male-looking chest, and we do genital surgery, where we remove the internal organs and the vagina to create a phallus, and that is a phalloplasty. And we remove the, we create a scrotum, and we also put in an implant so that the individual is able to perform the sexual functions too. So when we come to any surgical intervention, there are two things that we are asking the individual. Is the individual looking for these surgeries to pass. That means, are they smaller processes? Because we have that option, and those can be offered to the individual depending upon how they what they perceive their discomfort to be. Are the procedures that the individual asking to be able to use the washroom as a male does or as a female does? Because then we will do only that. Or do the individuals want to get a procedure done so that they are able to have sexual pleasure just as any other human form can have? Then we go on to those kind of procedures. When we are talking about masculinizing surgeries, we have very less people who ask for facial masculinizing processes. Because when we have individuals who come for gender affirming care and want to appear feminine, then they want the nose to look like that of a female, maybe the chin reduction to happen, the brows to be reduced. But mostly males, and males are so boring that they are very happy to just have facial hair, and most of the facial hair hides the chin and takes away the requirement for doing masculinization to change the way the angle of the jaw is looking, or to change the shape of the nose. So facial masculinization processes are not very commonly used, but again, these are available to the individual who so desire it, depending upon the level of discomfort that it is producing for them. Reproductive and sexual health is an integral part of health. My ability to produce a child, my ability to enjoy the sexual act comes under this gambit of reproductive and sexual health care. And this is something that we look at when we are giving gender affirmative care, because we, as a gender affirming team, do discuss about what is the practices that the individual is looking for, achieving sexual pleasure. We do talk about contraception because we may have a person who has undergone some interventions but has retained the uterus, or retained this thing. So they have the capacity of becoming pregnant, and herein we need to talk about contraception. Integral to sexual health is also prevention of sexually transmitted illnesses. And this is another area where the gender affirmative team needs to sit down with the individual and talk about safe sex, talk about contraception, talk about using condoms, and talk about PrEP, talk about prevention of HIV. We also need to talk about parenting, because parenting, like I said, is a very human need of the species. And today, when we have cutting edge technology, when we can preserve sperms, we can preserve ovas, we can do artificial insemination, we can use surrogacy, we can go further to offer processes which can allow any couple, hetero or gay couple, to be parents, at least have one set of their genetic code being shared with their offspring. This is all possible now. And if it is possible, then denying this would be something which is unethical, and hence gender affirmative care. I will take you back to the slide which I showed about half an hour back, where I was talking about fertility preservation, and we talk about fertility preservation before we start any hormonal intervention. So we are talking about fertility preservation before 18. People need care to prevent diseases, just as the cis hetero majority does not even think about it when they go to a doctor and he takes does a prostate exam to rule out prostate cancer, or asks a lady to get a mammography to do early detection of cancer, or do a pap smear to prevent cancers. Now these all facilities need to be provided to people who are diverse, and also give them tips as to how to prevent lifestyle disorders. We also need to understand that a large proportion of diverse people are on cross-hormone therapy, and taking any intervention from outside has its own issues. So when we talk about gender affirming care, we also talk about issues which are related to hormone therapy, and we need to educate the individual regarding that. Cancer prevention I've already talked about, but one area which we are not talking enough is aging and geriatrics. And yes, we require lifelong care with compassion when we are talking about diverse people. Why diverse people? Lifelong care with compassion should be given to anybody who walks in to a person who has the ability to give care. And that is why it is so important that if we have well-being, and if we are talking about well-being, then these conversations start very early in life. In fact, they should start the very moment we celebrate the birth of any human form. So I have on my screen this very interesting birth certificate, and I will walk you through this. It looks like a certificate which would be issued by any Nagarpalika or any hospital. But what is different here is that here, this certificate says sex assigned at birth, male stroke female stroke ambiguous, and gender will be affirmed by the child later. Yes, if we write just this one small line on any certificate that is given henceforth, then we have started a dialogue, because this parent is going to turn around and ask me, Dr. Saab, why have you written this line? What is this sex assigned at birth, and why are you saying that gender will be affirmed by the child later? Isn't sex and gender the same? And yes, this is the opportunity that we take to start talking about gender being self-affirmed. And since I do not know what this human form affirms to, because I do not know the language that this human form speaks at birth, I cannot tell you what gender this human form possesses. But yes, I can give you a sex of rearing. I can assign a sex at birth, and hence this is what I have mentioned in this certificate. But Dr. Saab, is my child normal? Yes. Very much. Because the word normal is something that we all need to understand. We all need to understand that this human form needs to be celebrated. We take these opportunities with such certificates to have these sensitive dialogues. Or we could sidestep the question and say, don't worry. If you ever come across any parent who is faced with a child who's expressing differently, or a child who's having gender incongruence, then you will remember this conversation and you'll be able to help that individual. Help that individual understand that this child is as normal as any normal human form that is there on this earth. So this is a birth certificate that I want you to talk about, to ask your providers to talk about, and let's start dialogues. Let's take opportunities to inform people and educate ourselves. A very long and I hope informative presentation that I put in front of you. So I am open to any questions that you may have. I'm going to stop sharing my screen, and I'm going to hand over to Dr. Ravindra and ask him to take charge. If there are any questions, I'm willing to answer.
Thank you, Dr. Sharma ji. I feel after this session, maybe we could have kept some more time. Really needs a lot of time. I mean, such information is not given or taught in the schools and colleges. So definitely, I think this should be made part of curriculum. Otherwise, we need to have a sessions in school level, college level itself, so that they can understand at the early childhood level itself what is sex, what is gender, and what are different perspectives to understand what are these developments that take place child and around.
Very rightly said, sir. And that is why it's so important that teachers are trained. Because after the parents, it is the teachers who the parents also look to. The parents look to two very important people. One is doctors and the other are teachers. And this is a subject which doctors are do not know. This is a subject which teachers do not know. So the parents are left with no choice but to, become party to the marginalization, become party to creating unhappiness in their own children who they brought up into this world with so much love. I have never seen a parent who did not want the child that was coming into the world. And we now hear stories where we have these very parents who, when they turned to doctors, did not find satisfactory answers. When they turned to teachers, did not find satisfactory answers. And that is why that birth certificate, which I showed you, becomes so important. Because sex can be assigned at birth, but gender is something which the child will affirm later. Maybe in school, maybe in college, maybe in the workplace, maybe at old age. But gender is personal. Sex is assigned. And the beauty is this, that the incongruence is not with the individual. The incongruence is with society, and that needs correction, sir. Thank you so much. I'm sure Dr. Bela has a little bit more to add to this. I've left her with just about half an hour to talk about the parent support groups and how they are important in this whole thing.
Yeah. Yes. I had, I think, about half an hour.
Yeah, ma'am, you can
Yes.
take your good time.
All right. All right. So I'm Dr. Bela. I'm going to talk about parents' perspective. So this is basically we can when we talk about the parent support. There are again two aspects to it. One is when a child comes out to the parent, and when parents come out. So there is two kind of uh, coming out. So see, children are very perceptive. A child takes cues from the people around them, and they will start behaving the way they feel they are expected to. Like Dr. Sanjay must have already explained that uh, children know their gender at a very early age, and at a very early age gender gets kind of fixed. In some cases it may remain fluid for a long time, but most of the times the child knows. Whatever the sex of rearing, the child knows what their gender is. But a child also understands that if they behave in a certain way, that is accepted, and that makes people around the child happy. So they start behaving in that particular manner, and they start conforming to that particular gender, so that they meet the approval of everyone around. And that is in fact the beginning of trouble, what should I say. Now what happens is this starts becoming more obvious when the child achieves puberty. So now one thing we have to understand, see, a child is a child, and this is one thing we have to make very sure as parents to uh, let the child know that whatever happens, I love my child. And this again, like I said, the coming out is a parent may have already realized that the child is maybe different, or the child is not expressing themselves. Maybe the school teacher has said that the performance is not up to the mark, or there is a change, or the child is become a loner, or there is a change in behavior. The child is becoming slightly depressed, or uh, not interacting with others. Or there are some children, especially children who are more who are, I would say, intelligent, more intelligent, or extroverts, or who are able to hide their identity for a longer period of time, who would not express it, where the parents also would not realize it. Now for this child to come out to you takes a lot of courage. So one thing that one has to realize is that when a child is coming up to you to tell you something, it takes a lot of courage. The child is coming to you because they trust you, and they have this inherent belief that you will love them no matter what. So first of all, do not break that trust, because the child is more scared than you are ever going to be, or you ever are going to realize. The first reaction, of course, most parents is going to be a little shock. So if you have anyone that you know, or if you have anyone in your say acquaintances, or in your say family or friends, so the first reaction is of course that of shock. But then what we have to tell the child that this is we are there with the children no matter what. Second is my weapon is knowledge. So arm yourself with knowledge. Whatever kind of knowledge you can lay your hands on, social, legal, medical, so every kind of knowledge you have to know. You have to know what gender is, what sex is, what transgender medicine is, what are the different kinds of therapies available, what are the different kinds of procedures available. You have to understand that it is not cure, it is care. You have to know what is right, what is wrong, and you have to know what your child is saying is right. There is no illness, it is not an illness. The child knows what the child wants, and you can be the biggest support system for the child. And if you are with the child, then everything is going to be absolutely all right. So first of all, you have to understand. Second step is accept, and then go from there. Name. A lot of children do not want to keep the same name. Name becomes very important for children because that is something they identify with. So along with their body, their shape, their external appearance, their name also becomes as important. So you can ask them, okay, if you want to change your name, maybe the official change will take time, but let's at least start calling the child at home and be very candid. Okay, there are going to be times when I'm going to forget and maybe call you by the dead name, and maybe there are going to be times when I may call you by your the earlier gender. But yes, that is okay. We are both going to make mistakes because it is going to be a two-way learning process. That is okay. The child also understands that. Next is support the child whichever way the child wants. Maybe it is some kind of dress the child wants. Maybe it's some kind of accessory the child wants. Or maybe the child wants to, experiment with some kind of makeup or shoes or something like that. Be there with them. Instead of the child going and, uh, shopping with people you are not comfortable with, or going out with people who may not actually be the right kind of people with the child, it's always better that you are there with them so that you can give them the support that is needed. Then next comes, you are giving all the support to the child. What about your own support? Because see, for child has come and unburdened themselves to you, and now they know, okay, I have told my parents everything is going to be all right. I am going to get the life that I want. What about you? As parent, you need as much support or probably more than the child. Again, for parents, their extended families, their friends, their workplace can become a very big support system. But then again, it depends upon your activity circle. If you are comfortable, you can include them in. If you are not, there may be some people who would be very supportive. Include them in if your child is comfortable with that. There would be people who would not be understanding, who would not be comfortable. There is no need to include them in your family. You don't really need them. Then there are a lot of parent support groups. In India, we have a support group called Swikar the Rainbow Parents. This is a very big, again, supportive organization. They conduct a lot of webinars, seminars, other activities. So what happens is parents can get together, talk to each other online, offline, and get to know and understand that yes, this is not something that is happening only with me. This is something very normal. This is something which happens. It is not my fault that my child wants to change the gender, or my child wants to undergo surgery or hormonal treatment. This is something which is very natural, and I should not feel guilty about it. So parent support groups are very, very important. Then there are some children who are more comfortable with, one parent. Most of the times it's the mother. Some children are more comfortable with the father also. But my advice is always involve the other spouse. Why? Because it's ultimately it's a joint effort. It's both the parents together and the children together. When all of us are together, only then we can face something which ultimately may become a life-changing decision for the whole family. And lastly, like I said, children are very perceptive. If you call your daughter as he, it may be a genuine mistake and she will forgive you. But if you call her she, but still, you perceive her as a son, she will not forgive you and she will understand. She will know. So accept, and once you accept, only then the child will also accept you. So for parents, like I said, it's important for parents to support the child and for parents to support each other. So there's something I had actually written from a child's perspective. I would like to read that out to you. Do we have time? Dr. Vinder?
Yes, ma'am. Please continue.
Okay. So every time you tell me to smoothen my edges in order to fit in, I diminish a little. I never knew I was rough till you showed me. Every time you look at me and then look away, as if you can't bear to see my pain, I diminish a little. I had no pain till you showed me. Every time you turn your back to the questions you don't want to answer, I diminish a little. I never knew I sought answers till you showed me. This sarcasm, veiled laughter, cruel comments, snide remarks, I take them in my stride. What kills me is when you say you love me and the look in your eyes implies, though I wish you were different. And I wonder, if you love me, why can't you accept me the way I am? The way I am. We need to accept the children the way they are, give them unconditional love, unconditional support. Child is a child, a parent is a parent. And the bond between parents and children is something which remains there all of life. So as parents, be supportive, be empathic, give them whatever kind of help is required, but at the same time, give help to yourself also. Arm yourself with knowledge and get whatever information you can. Thank you.
Thank you, ma'am. Ending with a nice poem. Really, that is what required. And as we know that mother never judges.
Fathers also don't.
Yeah. So it's really nice. Actually, in fact, need of the hour. Even until I attended this session, I also couldn't recognize the importance of the session. And now I think definitely we need to have a session at least once in a month to varied audience so that we can reach more people.
Absolutely.
And we need to take this to schools as well, schools,
Absolutely.
colleges, universities. So many participants are, most of them are from universities only. They are very UG students, PG students, research scholars, and also academicians, professors from various universities. Hope this message will go to all academic institutions. And soon we will be able to organize more such sessions. That is the need of the hour. And it was very well articulated and very well presented by both of you, Sharma ji, and also you, ma'am. We need to conduct more such detailed sessions, maybe a kind of workshop where they can be involved and they can interact and learn. So that will be more useful, I think, when it is coming to children, especially school children, where they understand. Maybe, uh, though it is very simple to understand, but maybe the playway kind of thing is more beneficial for children. I think with little bit modification in the content can definitely go a great way. So we will definitely look forward, ma'am, with your support. And definitely, this has to go a long way in conducting more sessions. And initially, I was also when we finalized the topic and when we were discussing in the afternoon with the sir Sharmaji. So initially, I thought it would be for a very specific target population, but now I think that it's definitely not for any specific population. It's for everyone.
For
This
everyone.
content has to reach everyone. So definitely we need to have a wider reach. And thank you very much for giving lot of insights and a kind of perspective how to go about understanding these sex and gender perspective and different factors uh, and different ways to understand these gender roles and gender bias and also various factors that govern stages that govern and decide about gender by the child, by the parents, by the society, and by the community or nation at large. Thank you very much, ma'am. And participants can unmute yourself or raise your hand so that we can take up few queries or clarifications or even comments. Feel free to ask, raise your hand so that we can unmute yourself. You are unable to unmute.
I have put my email ID and mobile number in the chat. So those of you who wish to contact us can send us an email. I've also mentioned our website address, so you can have a look there. We have put online certificate course which is free of cost on the ATI website, and this goes with the name of Gender Friendly Educational Institute Initiative, and it will arm you with some information and stimulate you to think and share with others also. So do visit the website, look for the Gender Friendly Educational Institute initiative that we have put. We are also working with the Ministry of Health and with the Ministry of Social Justice also to raise these issues. So please come forwards. We require young people to help us understand and make the world a better place for everybody. So that is my appeal to everyone who's attended the webinar. We are also going to be having an international convention on the 1st and 2nd of November. So, please feel free to attend that. Those of you who are interested in the social sciences, we have something for you. Those of you who are interested in the medical sciences, we have something for you. And if you are a child or if you are a parent, then too we have something for you. So thank you, Professor Ravindran, for giving us such a platform. And this is a bold subject, and it requires bold people like you to push it forwards. Thank you so much, sir. I speak on behalf of my wife and self for giving us this opportunity. Thank you so much, sir.
Thank you, Sharma ji. In fact, this is not at all a boring subject. As far as I am concerned, I really enjoyed it. And most participants also, there was stability in the participants also. So I don't assume that it's boring, but it was, definitely for children. Much more creative can be there, which can be engaged. For interaction, because children like playway. So definitely we can customize when we are going to schools and colleges. Definitely would like to collaborate with you, and we'll see. We will take this information to more places and more people. Definitely, sir.
Do think of us whenever you want us to do a workshop. We do pre-COVID we were doing workshops in schools, and we were targeting the teachers. So my idea is to talk to the primary school teachers so that they understand gender development, and we also teach them how to make classrooms gender friendly. And how to give a nurturing environment. So that is something which is part of the activities which Ati does. And we would love to, participate in any venture that you take on. If we can support you or help you in that, it will be an honor for me.
Sure, sir. Definitely, we will. Start with online initially, because now slowly places are opening up and exams are going on. So maybe immediately we cannot go offline, but definitely once the academic year opens up and now the exams are over, and then we'll definitely go for offline. In the meanwhile, we will plan few online schedules or online certificate course as well, because teachers also become available in vacation. So maybe we can engage few teachers from across states, or from here, or in a similar way, and we can definitely bring awareness that would help them us and in the long run. So we have few comments, and the chat box. Let's see if there are any unleft queries unanswered. So from Shabnam, we have wonderful enriching session. Thank you for this effort. And from Shiny, there is a query. I hope it was answered again anyway. Whether the dressing style influenced the gender orientation. Sir, would you like to comment?
Could you repeat the question, sir?
Yeah, it's from Shiny. Whether the dressing style influenced the gender orientation?
Shiny actually is the other way around. When we dress, we actually show others what we are feeling inside. So when I go to a party, I want to, dress up in a different way. When I go for a official function like today, when I was asked to speak in this webinar, I am expressing my inner, by my dress, I'm conveying that intellectual kind of a look. The same person in a different situation would be expressing differently. So gender expression is by the dress that I wear, and it may not convey the gender that I have. So, secondly, influence is something which involves the environment also along. So, if I'm in college, let's say, then and I, when I go from school to college, I want to try out all the latest fashions that are there. But I am influenced by what my teachers around also permit, right? Or what my peer group would be permitting. So dressing does not influence gender. Gender expression is expressed by the dress that I put on, and the two are very different. I hope I have not confused you and I have answered the question. Does that answer your question?
Hope it. Very well said, sir. Let me, there is a new. Yeah, thank you, sir. Now it's cleared. Okay, sir.
Okay. So I have
Uh,
put a link in the chat, which is for this gender-friendly educational initiative that we had started. It's an online certificate course, and those of you who wish to take it can go to this link, and it's free of cost. There is no cost that is involved. It will answer a lot of questions that you probably have in your mind, and you can always reach out to me. I would love to answer anything that is missed out.
Sir, yeah, one query from my side, sir.
Yeah.
Can we conduct this online course through an interactive mode, like through like this any one Sunday? Can we take up this course and we can certify at the end of the day?
Definitely. In fact, yes. Whenever you find time, we will make time for this, and we can do an online kind of a teaching kind of a activity. But if it has to be participated, then maybe a selected audience, so that we can run a pre-course questionnaire kind of a thing, and then answer specific questions and build it up. Yes, it could be done. We can have a discussion and plan out sessions.
Yes, sir. Maybe when we reach out to schools or colleges one day prior, we can go there, and once we decide on the mode of conduction and the way the content goes, or maybe a blended approach where we can play the video, or we can have discussion, and also we can take up assessment online, or with prior registration, or we can work out on some methodology.
Absolutely, I am game for this. It will be an honor. Like I said, we will get some more faculty also to explain things in a better fashion. I am associated with a group of young, vibrant students who help me with these workshops, and I'm sure they would be more than happy to educate other people.
So definitely I will work out and we will soon have such a collaboration. Yeah, and any other participants, if you have any queries, you can put it in chat box or you can raise your hand or you can unmute yourself. Contact details has been already shared. Great sessions. Thank you both speakers
Thank you so much, sir.
from IDA D'Souza. Sorry. Very good program by Vinod Kumar. By Saral, really great information. Yes, there are a lot of appreciations and
Thank you so much.
thank you
Sir.
very much. We did justice to our day.
Thank you so much, sir. Thank you so much. With your permission, I'll take leave, sir. And God bless all the people who took time to listen to us and do discuss the birth certificate that I showed you, because we do need dialogues to start very early in life, because gender incongruence, you'll be surprised to know that the figure that we have now is about 2 to 4%. And if you talk about India, then 2 to 4% of our population is more than 2.6 crores. And if we talk about percentages of people who are diverse, that means if I take people who have gender incongruence and add to that people who have differences in sexual orientation, and I add to that the small percentage of people who have differences in sexual development, then this percentage goes as high as 15%. You heard it right. 15% of young people, belong to the LGBTQAI plus community. And if we are not providing for 15% of our population, then we are really not going to be, able to maintain, to attain the goals that we have set for ourselves. We can never be called a progressive society. So please question and come forwards and create spaces where people are able to express themselves. Don't judge anybody. Whatever you have read is just a very small part of the knowledge that is there. The greater part of knowledge has to be taken from this vibrant subset of people who we chose to not see. Right? So with that, I will take leave, sir. And on behalf of my wife, on behalf of ATI, the Association for Transgender Health, I would express my gratitude to you once again, sir. We would love to collaborate with young people, with knowledgeable people, with not so knowledgeable people, with people, to make it more comfortable for people. Thank you so much, sir. I'll take leave.
Thank you, sir. We are grateful to you and thank you for accepting our invitation and joining us. And also, we thank all the participants for joining us for the wonderful day. And kindly fill up the feedback form. It has been shared in the chat box. It's mandatory to receive certificate. And certificate will be issued within 15 working days. So kindly join Telegram channel. where the certificate link will be available so that you can download your certificate. And it's also the certificate link will also be provided on the webinar series website. So you can download from there also. But we regularly keep posting updates in Telegram channel. So do join Telegram channel. If not join, where you get daily updates on daily programs are going on. So you can get updates for all the upcoming programs and certificate links. Thank you, sir, once again. So I thank all the speakers for the day. Dr. Sanjay Sharma, CEO and Managing Director, Ati, Board Member, W Park, and also Dr. Bela Sharma, Additional Director, Internal Medicine, FMRI, Medical Director, IPATH, Founding Director, Ati, for their wonderful contributions to the day and enlightening sessions, and also all the participants on behalf of Sri Holistic Health Foundation India, Sri Research Institute and Center for Arts, Sciences and Wellbeing, and also Association for Transgender Health in India, and all other collaborators. Thank you once again for joining us. Have a great day. Take care.